I am Dr. Daniel Potter. I am a reproductive endocrinologist with the Huntington Reproductive Center and Microsort West. I'm located in Laguna Hills, California. I've had the pleasure of taking care of patients from every continent except for Antarctica. So, we have a lot of patients from Asia, we have a lot of patients from Western Europe, a lot of patients from Australia, New Zealand, so pretty much everywhere. Well, typically the initial consultation with an international client is going to be done over the telephone, although we use Skype and we'll try to do a video conference if the patient is capable of getting on. That's always helpful. So that's my favorite way to do it, is just do like a little video conference. It actually works very well. Frequently, patients that are coming to see us from other countries are coming to access services that are not available in their country, and this may be due to just the technology isn't available there, such as the Microsort gender selection technology, or it could be that it's illegal there, which is the case for a lot of the patients that are coming to access surrogacy or egg donation. I would ask the clinic, how many of these procedures do you guys do a year? Do you deal frequently with international patients? Dealing with international patients has a unique set of challenges. So I would look for a clinic that has experience with, experience dealing with international clients, extensive experience in surrogacy or egg donation, or gender selection, or whatever it is you might be accessing. You don't want somebody who's dabbling in this, and there are lots of dabblers. There are a few, very large centers. California is the ideal state to do surrogacy in the United States because we have both legal precedents and statutory law that strongly support the rights of the intended parents. And so because this is the best state in the United States to do surrogacy, and we have the largest fertility practice in California, we do probably do more surrogacy than anybody in the United States, I would say. So, so we have a lot of experience with surrogates. We have a lot of experience working with couples from other countries. It's something that it's fun. I usually will have the patients try to get them to send us email us a picture of like where they are, what it looks like. If I were looking for a clinic, I would look for experience. I think that's the main thing. Clinical excellence, proximity to the beach, For me personally, I do not treat couples when the intended parent is going to be too much greater than 50 years of age when we initiate it, and that's just a restriction that we have. Our clinic restriction, I think the cutoff is 55. We treat same-sex couples. We treat couples that are traditional couples. We treat people that come in by themselves and don't have a partner. So we pretty much treat all different permutations. We look at each case, individually. Basically, we treat whoever needs treatment. My personal statistics would be the only thing I could really comment on. It all depends on what the egg source is like. So if we are dealing with eggs from a young patient, the pregnancy rate depends upon whether you put 1 or 2 embryos back. If we put 1 embryo back, the pregnancy rate is around 50%. If we put 2 embryos back, the pregnancy rate is going to be in the 70s, usually. 70, 75%, somewhere in that range.